Good afternoon, everyone, and welcome to the Ebony Horsewomen virtual panel discussion on COVID-19 and its impacts on at-risk youth. We've got a lot of you joining the discussion right now, trying to get on the platform. So we're going to give it another 30 and we'll see you after the break. Good afternoon, everyone. I want to welcome you, our viewers and our panelists, to the fourth installment of the Ebony Horsewomen Incorporated live stream discussion series on the impact of COVID-19 on at-risk youth today, tomorrow, and in the future. Thank you for sharing a bit of your afternoon with us, and thank you for your willingness to stay in conversation with us on all things COVID-19, including now the vaccine rollout efforts. You know, these conversations started exactly a year ago, back in April of 2020, when we were all literally under siege. When we launched this series, we wanted that discussion to be the first of several thought-provoking and frank conversations about how this crisis is impacting our most vulnerable kids and families.
Right now is that the ACLU was able to get testing for folks who are incarcerated in the state of Connecticut. So there's about 10,700 people who are incarcerated. Unfortunately, 80% of them
is going to have lasting effects on children, but particularly these young children, where this is the gateway of their eventual development. And what I don't hear the media saying is, how are we going to
into the fall and still having to do distance learning? And so I wanted to hear from their mouths, like what can we do in terms of constructing our curriculum that will support you.
And so starting with that first discussion, we brought together clergy, early childhood specialists, mental health practitioners, public health advocates, medical doctors, principals, state senators, city council members, educators, sociologists, and criminal justice and environmental justice experts to talk through the hard issues. Issues including systemic inequities and disparities and how disease in general affects Black and Brown communities, and most certainly how COVID-19 hit Black and Brown communities the hardest. We talked about the already glaring achievement and education gaps faced by low-income and at-risk students when the nation switched to remote learning, and faced head-on the reality that our kids would most likely be among the most left behind when schools finally reopened. We talked about the isolation, the trauma, the confusion, and the sense of loss that we're all feeling as adults, and how that was and still is magnified for our youth as they don't have the tools, the resources, or the life experiences to constructively express or deal with those feelings. We moved forward in the discussion to parts 2 and 3 in this series, where we confronted the horrifying statistics of how COVID-19 had dramatic impacts on the Latinx community, immigrant communities, single-parent households, and folks living paycheck to paycheck. We also took a look at how small Latinx and Black-owned businesses were heavily impacted. We talked about systemic racism and the toxic stress and fatigue it creates, and the impacts that it had on our youth's lives in profound ways. We looked at how it affected physical and mental health, impacting decision-making, disrupting learning, and even affecting immune systems in our youth. We dove into issues related to environmental justice, poor environmental health outcomes, and the links between air pollution and COVID-19 fatalities. We talked about the horrifying irony of hand washing being critical to preventing the spread and contraction of the coronavirus, when for many in our society, reliable access to water was not a given. We delved into the complicated nature of threat multipliers and comorbidities that doubled down on negative impacts on minority and low-income neighborhoods. And we unpacked the 1-2 punch of the pandemic and social unrest sparked by, in part, the murders of George Floyd, Ahmaud Arbery, and Breonna Taylor, and others, and the impact of that time on youth who didn't have access to after-school programming, their peers, or even summer camp as a way to cope with being Black and brown kids living in America. And here we are today to talk about all things vaccine, including the rollout efforts, hesitancy among minority communities, misconceptions, and conspiracy theories, and more. And we did something a little different this time. Instead of talking about our youth and their families, we talked to our youth and their families. Prior to this broadcast, I met with the students from one of Ebony Horsewomen's virtual classes, and I got to hear from them firsthand. We learned what they're worried about, what they're confused about, and what they want us to know. We also held a precursor to this live broadcast about a week ago, where we invited our communities to tell us what questions they want us to ask the experts. And I want to remind you that this is a live broadcast. We want to hear your voice. Any questions you have, add them to the chat, and our moderator will put them in the screen, and we'll do our very best to get to as many of them as possible. And so we've got a lot to cover. Let's get going. I'm excited about this conversation. My name is Heather Lawson. I'm a civil rights attorney, a doctoral student in advanced practice leadership in public health. I'm also the chairwoman of the board of directors for the Ebony Horsewomen. And I am, most importantly, I have the privilege of moderating today's discussion. So we are so fortunate to be joined by a stellar panel of experts. So please help me in welcoming all of our panel today. First up, we have Roxanne Ellis Denby, LCSW, LMSW, LPN. Roxanne is a licensed clinician and an outpatient therapist for the state of Connecticut Department of Mental Health and Addiction Services. She's been employed by the state of Connecticut for over 22 years. Roxanne is a part of Capital Region Mental Health Center's Trauma Initiative and is a member of the state of Connecticut's Critical Incident Stress Management and the Disaster Behavioral Health Response Network. Roxanne is co-owner of a clinical practice, A Mind's Journey LLC, along with co-owner Angela Washington and a diverse clinical team, providing individual, group, family therapy to children and adults. A Mind's Journey has partnered with Ebony Horsewomen to provide equine-assisted psychotherapy to children, adults, and veterans. Welcome, Roxanne. Dr. Gary Rhule, internist, is the author of Sailing on Broken Pieces, Essential Survival Skills for Recovery from Mental Illness, and he's a public health practitioner, healthcare management consultant, former emergency room physician, and former director of Health and Human Services in Hartford. He has expertise in federal and state public health policies and programs that address public health and human service needs. Patricia E. Kelly is the founder, president, and CEO of the Ebony Horsewomen Incorporated, which she founded in 1984. The Ebony Horsewomen is the leading provider of equine-assisted psychotherapy in the region, and as a result of its cutting-edge and multi-sectional programming, it's the only program of its kind in the United States. Patricia is a certified urban riding specialist instructor, master urban riding instructor, certified equine husbandry instructor, and is certified as a horse specialist. Patricia has received numerous awards, including being inducted into 2 national museums, the National Cowgirl Museum and Hall of Fame in Fort Worth, Texas, and the National Multicultural Heritage Museum, also in Texas. In 2014, Patricia was selected as a CNN Top 10 Hero and has appeared on ABC's Good Morning America, CBS, MSNBC, Fox News, The Dr. Oz Show, and The Queen Latifah Show. She was also a spokeswoman for Hershey's Brookside Chocolate Ballsy Women campaign. André Francis, welcome, Miss Kelly. I'm sorry, my apologies. André Francis, born and raised in Hartford, Connecticut, is an NCAA student athlete at the University of New Haven. He is an Ebony Horsewomen Inc. Summer Camp alumni, our resident Generation Z expert, and also a COVID-19 survivor. Welcome, André. Glynis Richardson, the executive principal of Thomas Snell Weaver High School, was largely driven by her father's lack of educational access and opportunities. Glynis is in her 25th year in education as a passionate advocate for educational equity. She currently serves as the executive principal at Weaver High School. Throughout her educational journey, she's been an English teacher, curriculum writer, program coordinator, high school principal, and facilitator for leadership development. As a new leaders trained transformational principal, some of Glynis's transformational school leadership work is chronicled in the ASCD publication, The Sights and Sounds of Equitable Practices, and the book Breakthrough Principles. She also holds the International John Maxwell certification as a speaker, coach, and facilitator, and is a trained and licensed trainer for restorative practices. She holds a BA in English and Secondary Education, an MA in Curriculum, Instruction, and Assessment, and an EDS in Curriculum, Instruction, and Professional Development. She lives in the greater Hartford area with her husband and children. Welcome, Principal Richardson. And I don't know, this next panelist really needs no introduction. However, you should know him as the King of Rock, Daryl D. McDaniels, author, humanitarian, hip-hop health educator, Rock and Roll Hall of Fame inductee, Grammy Award-winning rapper, pioneer of hip-hop culture, and founding member of the hip-hop group, come on, y'all gotta know what it is, Run DMC. Hey, D.
Thank you.
Used to, right? I know you're used to like thousands of people going hard and whatever.
Yep.
But,
Yep.
And that's what we had. That's
Thank
what we
you. That was awesome.
had. Yeah?
That was simply awesome.
Welcome. We're so happy that you're here with us, that you could spare a few moments to join us to talk about this super important topic.
Yes.
I think that a lot of people might be wondering, though, just kind of as a foundational matter, how we were able to get you, what your actual connection to Hartford, Connecticut is. You want to talk about that?
Yeah. My wife is from Hartford, born and raised in Hartford, Connecticut, Zuri.
Hartford, let's go.
Andre's family.
That's right.
Yep.
Andre's family.
Yep. That's my family over there. Yep.
Actually. Yeah, Zuri McDaniels, ZMC of
Hartford.
It's from Hartford, Connecticut. So all you kids out there, when you're wondering what you can brag about Hartford for, all the many things that you might say, also add, we have a connection to the King of Rock himself.
You have the Queen of Rock.
And the Queen of Rock
is from Hartford.
Rock, actually, right? D-Son,
yep.
You got D-Son in there.
Yep, the Prince of Rock, and he's back there.
So how have you been? The last time I saw you, we were at Comic-Con in New York. There were thousands of people there. You were talking about your comic book. And then I don't know, that was pre-COVID. I don't know if we'll see those times again, but how have you been since everything's happened?
I mean, I've been okay. It's been crazy. I know that everybody is going through something because of this pandemic. Physical health is very important, but also your mental health and stuff like that. So the first 3 days of the pandemic was like crazy because you're like, oh, is the world going to end? What's going to happen with my occupation? You had all these what ifs, you had all of these fears, and you had all this anxiety and stuff like that. But if you focus on things that you like to do, focus on positive things, and stay off the internet and don't believe everything you read on social media, you will be all right. You'll be all right. Because, you know, you got to think about it. We had generations before us survive in the midst of pandemics and disasters and natural disasters and wars and all of that stuff like that. And they was able to make it through, survive and carry on and you know, continue to be strong regardless of what was going around them, because they utilized the truthful information. And I think that's one of the things that there's a lot of misinformation out there. There's all these conspiracy theories and stuff like that. But you know, people need to learn. You have to trust the professionals. You have to trust the educators, and you have to trust the people whose jobs are to protect us, make sure we're healthy, direct us, and also instruct us. So those are kind of the things that I was able to do to, you know, get through this pandemic. And even when you think about, especially with the Black community, everybody's hesitation about, you know, this vaccine and wearing a mask and all of that stuff. But, you know, with the vaccine, the first thing we have to do to understand is that people do have a right to be a little hesitant because of certain examples throughout the history. You know, when you look at Tuskegee, the Tuskegee experiment. So the first thing Black people or people of color, I ain't gonna take that, they trying to do that to me. But I was able to understand what's going on. It's fortunate for me to be here, not just as a person going through it, but like you said earlier, I work with this wonderful organization called Hip Hop Public Health.
Right. Wait, don't tell us about that.
Okay. So
about that. Definitely.
All right. So real quick, I was fortunate to receive information from the sources, and that's a problem within our Black communities. We do not have access to the correct information, and we do not have access to those resources.
Yeah. I love that. And, you know, one of the things that you always talk about, you always make it a point to talk about mental health. Yes. And that is another huge thing. I read somewhere where you said, you know, going to therapy is one of the most gangster things you can do.
Yes, because people look at saying I'm weak, saying I'm vulnerable, saying I need help, especially Black men.
Yes.
They look at it as a sign of weakness. It's not cool. So a lot of them hide behind things, substances, and behaviors to protect their vulnerability. But when you give in to your vulnerability, that is the most powerful thing that you do. That's where you find the strength. You don't find the strength outside of you. When you admit, I need help, I can't get through this. But, you know, we have a tendency within the Black community, especially in athletics and hip hop. I mean, it's beautiful over the last couple of years. You see a lot of NBA players coming out and talking about it. But then you look at, you know, when you look at the NFL, a lot of these NFL players, in addition to the beatings that they take on the brain, the emotions that they go through, you know, I got to be a strong athlete. I can't show, you know, I can't go to therapy. I can't ask people for help. But if people understand it's okay to be weak, it's okay to be vulnerable, and it's okay to go to somebody and say, yo, I need help. But people, you know, a lot of us, especially in the Black community, we don't see that as cool, you know. So those are the things that I try to change, because I realize that the most powerful thing is information. Information, and also what we need with the Black community. You know, it's cool if you have professors and doctors and lawyers and prominent people and politicians and clergy and religious folks telling us something. But our communities need to see people from where they're from, who live where they live at, and who look like them.
That's so dope. I mean, I love that. And I think that you hit on that when you say, you know, especially Black men need to realize that there's nothing that's going to minimize your masculinity about going to therapy. And that message trickles down to the kids. And that's where we want to start, right? We want to absolutely influence folks who are our age and older, but we absolutely want to influence the kids so that they grow up with the mindset of therapy is healthy, therapy is cool, therapy is gangster, my heroes, therapies, athletes, and so on. And so it's something that it's not about weakness, it's about understanding myself and understanding my power.
Exactly.
One of the other things I love that you've done is you've really figured out health communication. You talked about it a little bit when you said, we have to put those of us who are out there in front of the Black community and have us explain what's going on with COVID, with the vaccine,
Exactly.
what have you. That's who we trust, right? Like you mentioned earlier, none of us were alive when Tuskegee happened, but we all say Tuskegee when we think about these vaccines.
We heard about it.
Yes, passed on generationally. And that is very hard to overcome, particularly when you're asking people to take shots, to put something in their bodies. But with someone like you, someone who everyone has looked up to for, ever, when you partner with doctors and healthcare advocates, public health professionals to create this body of resources for all of us to look at and enjoy and learn from, that makes it more accessible and it makes people more apt to trust it. Tell us some more about Hip Hop Health and the cartoons that you all put together and why you thought it was so important to reach the community in that way.
Okay, I've been involved with this organization called Hip Hop Public Health for about maybe 10 years now. It started about 15 years ago. It started with a doctor, let me get his name right, Olajide Williams. He's a doctor. He's the head doctor up at Columbia University, and he's from Africa. So he's one of us.
Yeah.
So 15 years ago, he started looking at our communities and looking at the problems that all of our community face, the lack of resources and the lack of information. But sometimes when that information is there, because of, he always says because of systematic racism, the opportunities to utilize the information and resources isn't there. So he looked at it like, okay, there's certain information there. People get told in their houses, mothers and fathers, teachers, clergy, doctors, prominent people, but people don't listen. So, he comes from Harlem. So he started realizing, he was like, but everybody listens to music. What if I take what people don't listen to when we talk to them and put all of this important life-saving information to music? Right. So 15 years ago, he hooked up with Dougie Fresh and he just started making these hip-hop rap PSAs, and they would cover everything from obesity to diabetes and, exercise and health and stuff like that. So he's been building the momentum and it's proven that it works. Like you just said, it's very important to get the kids to start the behaviors now. So he realized if I take this music, if I take this hip hop into the schools and I'm teaching the kids healthy eating, healthy behavior, healthy lifestyles, also teaching the kids when they see an emergency. Let me teach the kids how to call 911. Let me teach the kids to how to notice stroke. So he did all of that stuff. So he started realizing that it was having an effect because you could try to teach the kids ABCs all you want, but if you put A, B, C, D, E, F, G to a beat, the kids will learn it. You know what I'm saying? So he's using proven mental and psychological methods to get the important messages across to the community, young people and old people, so that they can improve their behavior. So once Dougie Fresh was on board, and then he told me, we work with Salt from Salt and Pepper, Ashanti, and my idol, one of the guys who has always given us information through his music, Chuck D, Public Enemy. So once they was on board, so basically what we do everything that you're doing right now, everything that the doctors is doing right now, everything that our mothers and fathers and grandmothers been telling us to do that we don't listen to. We take all that information and we put it to music so that people can understand it in a more easy, receivable manner. And what we just did recently. We took everything about this COVID vaccine. Yeah. What is the COVID vaccine? When did it came? What are the symptoms? Why we did it now? And we put it to music so people can understand it better than looking on the internet, looking on social media, and watching CNN and Fox News and all of that. So we put it in a language that people can understand it.
Yes. I watched it myself, and I was at the end of it, I was like, community immunity.
Yeah, exactly. Because people learn from repetition. But also, what's important to say is that what you're doing, what I'm doing, and what the doctors is doing is only effective if we all work together. Because, like you said earlier, it's me, DMC. But even me coming forward and saying that the COVID vaccine is cool, you need to get your shots if everybody's protected. It's not just for yourself, it's for the person next to you and for persons, people who are more likely to suffer if they do catch the COVID. I still got a lot of hate mail. Like they call DMC selling out. He's going against Black people and this and that. So the thing that allows me to have enough confidence and come on here and speak about this is because the doctors and the professionals and the scientists that I work like are from where I'm from. Like a lot of people don't know the COVID vaccine, the Black lady who was influential on getting us to this point where we could start putting this vaccine out. Now, a lot of people don't know it's a Black lady that do that. A lot of people don't know that it's a union, a coalition, a conglomerate. It's a multitude of Black doctors who have been at the front of this fight, developing this vaccine. People think, no, they made this vaccine yesterday and they're going to put chips in you and you're going to turn into a zombie. But a lot of people our communities need to understand that it's people of color on the forefront of the fight because of systematic racism and a lack of information and resources. It's the colored people that are most likely to suffer more than other people from well-off areas, if you know what I'm saying. So there's a system that always held us down. But what our people need to know is DMC only has the confidence to say, get the shot. We need to get the shot so things can get back to normal. It's only because there's doctors and scientists who look like me, who walk the streets that I walk, who've been to the schools and come from the communities, who are telling me it's safe.
That's right. I mean, and there's no doubt that people's concerns are well-founded. There was a time, right? There was definitely a time. But as you mentioned, with this vaccine development and the rollout, a lot of people of color were involved.
We've been involved.
That's us. And we have different oversight than we ever had before in the United States American healthcare system. There were clinical studies which were very rigorous. We're going to talk. We're going to talk about that in a minute with Dr. Rhule, who can really help us dig into that. But I'm so happy that you continue to highlight that. Like, listen, it's us across the board. It's not just us rolling it out to you saying, take this. We were involved with the development at every step, from scientists to doctors, which sends another important message, right, to our kids that, yes, there are Black doctors, there are Black scientists, there are Black female doctors. And yes, they're the ones that are out there at the forefront of the vaccine development. So they need to start, that's also a disconnect that our kids have, because they might not even really believe you, like, oh, D, come on. No, it wasn't. Some white guy.
Right.
So we need to absolutely make sure that they know that we're here, we're in this profession, and that we were part of this vaccine development.
Exactly.
I'm not sure if people know. They should know. I hope they know. But you also have a comic book that you developed some years back where you are the superhero. And I've heard you talk. Yeah, I've heard you talk in other interviews about how comic books really helped you going through things when you were young. How they helped you overcome maybe even some insecurities as a kid in Hollis, and that they were really helpful to you in your development. A lot of
Yes.
our kids, a lot of our kids, not only in Hartford, but throughout the United States, are going through it right now. They were locked down with the rest of us, but they had a lot less access to like the world, really.
Right.
And so, what would you say about comic books as a way of helping kids cope with this whole COVID thing, everything that they've experienced over the last year and some? They helped you. They clearly helped you get your confidence.
Yeah. Oh, for sure.
All these amazing things.
Yeah. Well, what I want all the kids to understand that the smartest person in the world, and you can ask any kid there, who's the smartest person in the world? A lot of them have heard of Albert Einstein. They know that guy Einstein with the funny hair, the white man with the funny hair. So the majority, I speak at a lot of high schools and middle school, so the kids know the answer. Say, who's the smartest child? Yeah, Albert Einstein, this and that. Albert Einstein, the smartest man in the history, one of the smartest men in the history of the world, he said, imagination is more important than knowledge. And that's one thing that educators know. The best educators know it's these kids' imaginations that will deliver them from whatever it is, it'll deliver them spiritually, mentally, socially, and physically, and all of that. So for me, the thing that allowed me to become the person that I've become was when I was reading comic books, it did something. It educated me. And I always tell the kids, reading will educate you. And the kids look at me, how would comic books educate you? Because if I'm reading these comic books, if you're looking at, Spider-Man and Iron Man, for example. So when you're reading these books, you're learning a lot about science. Mm-hmm. You know what I'm saying? When you're reading these books, you're learning a lot about the universe, the galaxy, the planet, and stuff like that. When you're reading these books, you're learning a lot about geography. When I was reading DC Comics was great, Superman and Batman and Wonder Woman, my favorite to read. But there was something about Marvel comic books that did something extra for me, that educated me, informed me, and even helped me as a student. Stan Lee, rest in peace. He was brilliant because he put the superheroes really in New York City. So when I would read a Marvel comic book, I'm a little kid. I couldn't leave the block at the time. I was one of those kids. My mom was like, "You have your butt in this house when that light come on." Right. So you all mad and stuff like that. But I understood that my mom's cared about me. So while I'm in the house, I got all this free time. Books was my access to the world. So every time I read Marvel comic books, I would learn about Manhattan. I would learn about the Lower East Side. I would learn about Hell's Kitchens. I would learn about Park Avenue and 42nd Street. I would learn about the Empire State Building and stuff like that. So that when I was able to go off the block, I already had knowledge of this information. And I always tell the kids, it was me reading these comic books that they call make-believe. But look at those words, make-believe. Make the world believe it's real. So there's a lot of education and useful information in the comic books, but it wasn't all just because of my imagination. I had teachers. Mm-hmm. I had teachers, rightfully so, who, because I was reading, I was a good reader. So I would finish a lot of my class assignments before everybody else. So I would try to sneak and read my comic book, put my comic book in the middle of my science book or my social studies book, and the teachers would know what I'm doing. But what I'm trying to say is the teacher would rightfully say, "Mr. McDaniels, bring me that comic book," and take it away from me. Uh-huh. Now, there were some teachers who never gave me the book back. But there was other teachers who at the end of the day would give me the book back because they noticed the fact that this kid is reading is making him it's making him a good student. And because I was reading Iron Man and because I was reading Fantastic Four, I'm seeing terms, ideas, concepts, and images that I'm hearing about in school. Comets, the rings around Saturn, asteroids, this and that. So if I'm reading it in a comic book, in order for me, I had a desire to understand what is Tony Stark talking about. So I got to pay attention to science so I can understand. So the comic books, for all the kids that have been stuck in the house, it was like their lives stopped. And it was at a point, some of the kids need the in-school learning. You know, some of them kids need that moment of in-school learning. But while they're at home, there's so much that a child or a youth and the kids can do. Use your imagination. Okay, you don't like reading, take out some finger paint. You don't like doing that, write a play, pretend. Pretend is pre-something. Pretend means pre-reality. So whatever you're pretending to be, all it is practice. So I'm encouraging all you kids out here that's on this, and any of you older people that got kids in the house, just go buy some comic books and go buy some space adventure books and Harry Potter, and tell the kids just to read them, because in the books, the key to it is, like you asked me earlier, when I started reading these comic books, I started seeing people who was like me that I seldom saw in my real reality. Because growing up, you got to understand, with this mental health with the kids, our kids have been traumatized. Yes. They've been traumatized by seeing what the adults been going through. They've been traumatized by seeing what's happening to, people of color, whether it's George Floyd or Breonna. So these kids are so traumatized. They need a release of creativity and imagination and access to information and things that make the kids think, to utilize their mind. It's things that's going to help them. It's almost like reading and writing and comic books and pretending and playtime and imagination. Without the kids knowing, it's good therapy for them. And even if a lot of kids is shy to talk about them things, you could hit the kids with like, yo, if you was a superhero, who would you be? Mm-hmm. And then you can ask them, what would be your superpower? 9 times out of 10, a lot of the things that they say they would be and what their superpower would be something that they're fighting in their real life. So me as a younger kid, growing up in Hollis, Queens, it wasn't Harlem and it wasn't the Bronx, in the 70s. But growing up in Hollis, Queens, it was no different from kids now growing up in Hartford, Connecticut. But when I would read the comic books, it was like the only time I saw powerful individuals who were nerds or brainiacs or very smart was in the comic books. When I saw Peter Parker, I saw myself. When I saw Reed Richards, I saw myself. When I saw Tony Stark, I saw myself. So by me having that in my household, in my private time, when I walked out in the world, I had a different enthusiasm or perspective of how I look by myself. What people need to understand, what's going on in our communities with our young people and what's going on in hip hop is not a problem that is created by the record companies. A lot of these kids are emulating and doing what they see on social media and hip hop records because kids have a problem with self-esteem. Mm-hmm. It was young people who created, and the young people that created hip hop coming out the Bronx in the 70s, they taught all young people, especially young people of color, an important lesson. Do not be ashamed of who you are. The fact that you do art, that's beautiful. The fact that you want to dance, those break dancers, they wanted to dance. They didn't ask for permission. They cut up some cardboard and put it on a concrete ground and had a dance floor. The only thing, what I'm trying to say is I want the kids not to be ashamed of who they really are. I tell the kids the coolest person in this school is the kid that don't want to wear Air Jordans because everybody else, and the kid that don't want to wear Adidas because of Run DMC. And they look at me and go, huh? You mean I can do what I want? Yes, the most powerful, hip hop is about the most powerful thing about you is what you like, not what everybody else like. So comic books showed me in the world that it's cool to be smart. It's cool to be positive. It's cool to follow directions. It's cool to seek and desire more information. And I always tell kids, when you look at education is just information. Information that you could get from your school book, your textbook, or your workbook. But information is also what you get off social media, what you get online, what your friends is telling you. Hip hop is about listening and utilizing the information that, number one, is going to get you where you're supposed to go. And number two, keep you out of jail, keep you out of the grave, and keep you on a positive track so that you can get all the things that everybody else has.
And that's it. That's it. 100%. Thank you so much for saying all of that. To reiterate, there is power in the pages.
Power in the pages. Yep.
power in the pages. And to circle back to what we were talking about earlier in terms of Black and brown representation, kids, you all can be like Dee, and you can also write your own comic book, right? You don't even have to
for sure.
Write your own.
Everybody has a story to tell, and what I want kids to understand that the other organization that I work with is the Felix organization.
Yes.
So we always tell the kids that your story can help save a life. Your story can help somebody that's struggling, and your story that you have is proof that you're not the only one in this whole world going through this thing. Don't be ashamed to speak up. What I like to say is, for all the kids, for all the parents, and even adults going through stuff, if you remove guilt and shame, you remove the pain. A lot of us, all of us in these Black communities have been traumatized. You know, by what we're fighting every day, the civil rights struggle, and even when they pass a law that's in our favor, it still ain't 100% there. So it's up to us, all you little kids. You guys are the futures. You know, we're fighting right now, but when we pass on and we're going, and you kids are 25, 26, 40, 50, and 60 and 70 years old, it's up to y'all to make sure that what happened to us and y'all at this time doesn't happen to the next generation. So the importance of education, you kids, education is getting all the right information from the right sources so that we can have communication. What we're doing right here, most kids think rapping is hip hop. They don't know art, dancing, storytelling, education, philosophy, science. They don't know that all of that is a part of hip hop, but they will not learn what hip hop really is. Hip hop is the art of communication. What we're doing right here now, this is representative of what hip hop is. It's the diverse, unique people from the same communities with different gifts, different information, different skills that we come together, and it uplifts our people and pushes us forward. But hip hop would not be possible if it wasn't for Chuck D, A Public Enemy, the teacher KRS-One, and great female leaders in our communities that we need more, especially with hip hop, we need more women at the forefront of these fights and battles, because we're missing the time when we had a Queen Latifah 24 hours on the radio, when you had a Moni Love when you had an MC Light. So the girls need to see girls in positions of power, and this is one step. Everybody on here, all the little kids that's looking at all of these adults on here, we are just y'all. Once y'all utilize the information and find your purpose and your destiny.
Absolutely. I mean, thank you so much. We're not going to keep you all day. We appreciate your time. I want to give everybody the address to the Felix organization. Check them out at www.thefelixorganization.org. Learn more about this incredible foundation, the camp that they have. I also want to send people to hiphophealth.org.
Yes.
You'll see a 5-part anthology, rap anthology that deconstructs vaccine literacy. If you're looking for a way to communicate with your kids, your young adults, or even yourself to understand more about the vaccine beyond this conversation, check it out. It's so much fun. It's so interesting. And it's
true. And it's the truth. And it's the truth. And one more thing before I go. In all levels of our community, there's always doubt, because you were thinking the entertainment business. I mean, there's my peers in the business is like, no, I ain't getting that shot. And it's funny. It's like, it's grown people, in wonderful aspects of careers. I'm not just talking about the talent itself. I'm talking about the doctors and the lawyers and the promoters. My career doesn't work without all the careers around me. Soundmen, lightmen, travel agents, lawyers to read my contracts to make sure nobody steals my money. But there was a lot of the same anxiety that at Hip Hop Health, we try to remove all the fears with facts. Fear and anxiety can be removed with the facts. So I just want to leave this one example. I had peers in my business saying, I ain't getting that shot. Oh, DMC, you selling out. You doing wrong to your people. You doing exactly what the white man want to do to the black people. So I had to hit him with this, and I'm going to close with this just to show that if the educators such as yourself is not working with the scientists and the doctors and people who have walked the walk and talked the talk are not communicating and putting out the dialogue collectively so everybody can understand, it's going to get us nowhere. So about 8 years ago, I had to go to South Sudan, Africa, which was crazy. I mean, it was crazy. It was a war zone, the child soldiers and all that. But in order for me to go there, in order for me to go over to South Sudan to perform, I was told I had to go get 7 shots. Now, the first thing I was like, what do you mean 7 shots? Well, you need to go get 7 shots because over there there's Ebola, there's SARS, there's MERS, and they named everything, and polio, malaria, everything that I needed to protect myself because I'm going over to South Sudan. So in order for me to go over there and have a good livelihood and get up on stage and be the king of rock and tell people to walk this way in my Adidas, in your Adidas, I had to go get to 7 shots. So when I'm here with my friends and I see people in my community having all this doubt, which they rightfully so, I tell them that story. I said, I had to go get 7 shots. I said, the reason why all of us in this Black community need to get the shot, not only to save ourselves, and if you don't want to do it for yourself, do it as a gesture that you care about the people around you. But I said, I had to go get 7 shots to go over to Africa to be protected by what was there. I said, this COVID virus has come to our home. This COVID virus is not a new virus. It's Dr. Williams, who I work with at Hip Hop Public Health. He fought Ebola. He fought MERS. He fought SARS, MERS and SARS, which are respiratory diseases. So doctors and scientists of color have been fighting diseases for the last 20 years. So when this COVID thing came, they were prepared, and they were prepared, armed and ready to give us all something that we could be protected. And I tell my friends like this, yo, I want to get the shots, because if I had to get 7 shots to go over to Africa and I only got to get 1 or 2 shots to do my job and pursue my passion here and have a healthy life, what do you think I'm going to do? And then most of them will say, oh, I didn't see it like that. But what I'm trying to say is, it's important that in our communities, we need more of this. We need the OGs such as me, with the professionals like all of you, and the young people like my nephew Andre, talking. Communication is the key to our victories.
Absolutely. Dee, thank you so much for your time. You
are
a hero, you are a legend, and you are a good person. So thank you for being all of those things more. We appreciate you.
Thank you. I'll see everybody at the next Comic-Con.
Yes. Right. Take care of yourself. Give our best to Zuri and Deeson.
Will do.
All right. Take care. Dr. Rhule, gosh, we kind of tiptoed into your territory quite a bit with a lot of these conversations. But this is where we absolutely need you. You are the doctor that we're talking about. Talk to us, please, about these vaccines. We talked a little bit with Dee about the mistrust in the Black community. Some of that comes from people thinking that these vaccines just got made way too fast. Previously we were hearing it takes 2 years at least to make a vaccine. All of a sudden we've got, 2 of them, right? And then 3 of them, and then maybe AstraZeneca, which is they're still kind of working through that. What do you say to people who say, these came too fast?
Right. Also, thank you, Heather. I'd say, obviously, knowledge builds on knowledge. So just as DMC just said, in 2002, there was the SARS, right? So severe acute respiratory syndrome. And we learned some things from that. And then in 2012, there was MERS, so the Middle Eastern Respiratory Syndrome. And then there was Ebola. So we've basically been trying to work with this technology for a long time. The reason why this was warp speed, so to speak, was we really had been using the technology in other places, in cancer research, with Ebola, trying to find some cure for HIV and in other diseases. So what happened really when coronavirus hit in 2019? The first vaccine trials really rolled out in January 2020. The reason why it moved very fast, I think, for a couple of reasons. One, we really kind of had the knowledge about how the vaccines work and how the immune response works. Coronavirus, even though that one was novel, wasn't really new. We've had it before. But what you had was the alignment of resources, federal government, really money, and people coming together to say, look, this is a global pandemic. We need to find a way to make this work. So that's really kind of why it happened that fast in terms of it being rolled out. Currently, there are 3 vaccines that are approved under emergency use.
Okay.
2 of them are what's called an mRNA vaccine. That's the Pfizer and the Moderna. And then the 3rd one that was approved in February is the Johnson & Johnson. That's not an mRNA vaccine, and I'll talk about that a little bit. So mRNA vaccines, basically what they do is the coronavirus has a gene, and what they did was they took the specific part of the spike protein. This is the thing that the virus needs to attach onto our human cells to enter the body. So that particular vaccine just takes the mRNA for only the spike protein, nothing else. Once you get that shot, the vaccine or the vaccine enters your own cell. The spike protein only is made. So your cell makes the spike protein, presents it on the surface of your own body, and then your body recognizes that as an invader, an infection, right? That shouldn't be there. And then what you get is an immune response. So your body starts responding to the spike protein, which is part of the coronavirus. The next time it sees the true virus, the wild type virus, your body has antibodies, and it also has other immune cells that basically attacks the virus and gets rid of the virus. That's really how the mRNA virus vaccine works. You can't get COVID from it because it's not the entire virus. It's just the spike protein. DMC just mentioned, right? So there's no tracking device in it, none of that. What happens to the mRNA after it's done? After it's processed the spike protein, your body degrades it. So it's gone out of your system. It doesn't change your DNA. You're not going to grow horns from it. It doesn't do any of that. Right? Those are the 2 mRNA vaccines. The 3rd is a Johnson & Johnson vaccine. And that's not an mRNA vaccine. That's what's called a modified or killed virus. It's something called the adenovirus, which causes the common cold and the common conjunctivitis. And basically what we did was we put the spike protein on that modified virus. You get the injection, and the process pretty much is the same. Your body takes it in, presents it, the spike protein to your body, and your body says, this should not be here. This is an invader. And then the immune response happens that way. I'll stop for.
No, all of that is super helpful. You brought up the Johnson & Johnson vaccine, and that's been sort of a hot spot in the Black community as well, because Johnson & Johnson vaccine has about a 77% effective efficacy rate, as opposed to the other 2 that you talked about, which are each about 90 to 95% effective. And so, the talk is that they're flooding the Black and brown communities with the Johnson & Johnson because, they consider those communities hard to reach populations. But the downside, of course, is they're less effective. So, what would you say to people who may register for a vaccine? All they have in their community at the time is Johnson & Johnson. Would you tell them, no, don't get it, wait for one of the other 2 that have been approved for emergency use, or what? And what would you say for people who are worried about this thing only being 77% effective in preventing coronavirus?
Okay, so you have a couple of questions. So this is what I would say. The flu vaccine that we take for work or routinely is only about 50 to 60% effective. And when you're comparing Johnson & Johnson to the Pfizer and the Moderna, really you're comparing two different things because the studies were done at different times and really in kind of different places, right? But all of the vaccines, the 95 and the 94% and the 70% really is about preventing severe infections. So even with the Johnson & Johnson vaccine, that 75% efficacy is about preventing severe infection. And what it's not being said publicly, but which is true, is it's 100% effective against hospitalizations and deaths, which is also similar to the Pfizer and the Moderna. So really, all three vaccines are appropriate for you. The only difference is the Pfizer is approved for ages 16 and above, because that's how the clinical studies were done. And the Johnson & Johnson and Moderna were done in persons 18 and older. So you're really kind of comparing two different numbers, but it's because the studies were done really at different times and during the summertime. They're all very effective, specifically for persons of color. We are twice as likely to become infected with COVID-19. We're 4 times as likely to be hospitalized from it. And we're 3 times as likely to die from coronavirus. So if all 3 of these vaccines are saying 100% preventing death and hospitalizations, you should take it anyway.
Okay.
So any vaccines that you get offered, I would take it.
Okay.
I'm not aware of any places where they're flooding the urban areas with Johnson & Johnson. The truth is, if you're trying to immunize 80% of the population, you really have to use what's in your toolkit to be sure everybody is vaccinated. Pfizer and Moderna are 2 shots. Some people don't want to get 2 shots, right? So some folks opt for, look, I just want to get 1 shot, which is a Johnson & Johnson, and I'm done. But they're all effective. I wouldn't get hung up with the numbers in terms of the efficacy.
Okay, that's useful to know. It sounds like take the vaccine that's available to you.
Yes.
Okay. We talked a little earlier about the Black and Brown representation in making the vaccines. Is there any data on how many Hispanics, African Americans, and people otherwise classified as Black were included in clinical trials for each of the vaccines? And why is that important? I want people to know why representation in clinical trials is important.
That's a great question. So first, the place you can actually get that information is at the cdc.gov. So if you go to cdc.gov and put in COVID clinical trials demographics or group makeup, you'll get something that pops up that shows you that information. The Kaiser Family Foundation also has a table that shows that to you. But specifically for these 3 vaccines, Pfizer had about 40,000 persons in their clinical trial. Moderna had about 27,000 or 30,000, and J&J about 20,000 persons in their clinical trial. For Black persons in the US, we make up about 12, maybe 12.5% of the US population. For both Pfizer and for Moderna, about 9 or 10% in both of those vaccine trials, including persons who were African American. So there was really broad representation, both in terms of, it wasn't the 12%, but it's still significant, right? So 10% of us represented in that trial. And why is that important? Well, I'll give you an example. If you do the study for either medicine or vaccine for, say, Black women who are basketball players, and you did 20,000 women who are like that, and you collect the data in terms of the effectiveness, preventing sickness, preventing hospitalizations, preventing deaths. The problem is you can't then use that information for the general population, because you have Black women who don't play sport, who don't play basketball, who are equestrians, you have men, you have different ages, you have different ethnicities. So you can't then use that information to apply to the general population. So I think in terms of just the representation for us, 10% in all 3 trials, that's, I think, pretty good. And it makes me then much more comfortable, not only because we were involved in the research We were the principal investigators. We looked at the data. We were involved in terms of that trial. That really says, yes, we feel pretty sure it applies to the general population and applies to us. If we don't get involved in a clinical trial, the problem is going to be the study will be done. Classically, white men, white women, if we're not included, truly, you cannot really then use that data and apply it to African Americans, Asians, or Pacific Islanders. You really need persons to be involved. Age has to also be included, which was the case here. They included persons who were from 18 and 65 and above, as well as some persons who had chronic health conditions, diabetes, obesity, HIV. Those were part of a clinical trial, and you really need to have that group represented as well.
Thank you. And so there's been about 20 million vaccines distributed across the United States so far. Have there been any deaths or serious illnesses or life-threatening effects as a result of people taking the vaccines that you know about?
So looking at the CDC data and what's published now, there are no directly caused linked to the vaccines themselves, right? No deaths, etc. There are, each time you go to get the vaccine, you're asked your health history. You're asked if you've ever had a severe allergic reaction to any vaccine or any medication, where you have difficulty breathing, you're short of breath, you're passing out, etc., because that's a higher risk for you. The other thing you should know is that even though the studies have been done initially, 6 months after a report was just done that looked at the risk of illnesses and death from these vaccines, and these are considered to be very safe. As well as there is still ongoing surveillance about the vaccines and any adverse effects that they may have. When you get your vaccines, I'll just quickly, you will get a thing that's called V-Safe. So if you have any side effects, anything, you're asked to report that into the CDC or back to the manufacturer so they can collect that information, so we kind of have an idea what's going on after the vaccines are rolled out.
Okay, so data collection is extremely important.
Yeah.
I want to ask you 2 questions from our kids. We want to make sure that the voices are heard. Some of them are watching live, so they may chime in also, but I definitely want to get to some of the youth questions. The first question from our kids is, once you have the vaccine, do you still have to wear masks and social distance to be safe?
Yes. So after you've been vaccinated, and really have to be fully vaccinated, right? So if it's a J&J, it's just one. If it's the other ones, it's 2. But really, you need to at least wait 2 weeks after to feel that you're fully vaccinated. The CDC has basically said the only time you would not wear a mask would be if you're inside your home with your family and they're fully vaccinated. But if you're out in public, you're going to be interacting with persons who you don't know if they've been vaccinated. You don't have to be fully vaccinated, so you still need to wear your mask, social distance, and still do the hand sanitizing that you would typically do. So the only time you would not have to do that really is when you're home with your family members who are also fully vaccinated. In the workplace, if you go to the workplace and you're vaccinated, you still have to do that. Still wear your mask and still practice all the other public health measures.
Okay. And then one other from our kids deals with the subject of herd immunity, something that we've heard about, in the ether over the last year. Many of us don't exactly know what it means. I'll be honest, I have a loose understanding of what it means, but how it actually works in practice, I don't know. And so one of our kids said, they have a family member that doesn't want to take the vaccine themselves, but they want everyone else in the United States to take it so they don't have to. This is confusing for our youth and confusing for me too. It sounds like they're banking on herd immunity. Does this make sense? Like talk to us about this person who wants everybody else to take it and so that they themselves don't have to take it. Does that work? What is that?
Yes and no. So,
okay.
So herd immunity is just a concept that if 80% or higher of the community of the nation or the globe is immune, there is less chance of spreading from one person to the other. So really, that's just the idea. So if you decrease the number of persons who are actively infected, because just like you and I, the virus wants to live. All the virus is trying to do is replicate and make copies of itself. That's really all it's trying to do. But if you have enough people who are immune, won't get an infection, and can't transmit it, you basically, the virus dies out because there's nobody who is susceptible and then can pass it on to somebody else. So that's really the idea of herd immunity, so that you have less people in the community who are infectious and to spread it to somebody else. The reason why I said no to the person who doesn't want to take the vaccine is the vaccine protects you for several reasons. This particular virus is, obviously, as you know, is deadly, right? So people in the US, 560,000 persons have died. But you also have the phenomena of what is called long COVID. So people who didn't have any, they were infected with COVID, had no symptoms, or they had symptoms and they recovered, but they still end up with problems with their brain, problems with their heart, their lungs, their kidneys, their liver, and just significant health problems because they got infected with the wild type coronavirus. So even though conceptually, yes, herd immunity will protect you, but if you yourself become infected, I think because this virus is just horrible, that's no other way to describe it, you need to protect yourself and really protect your family as well.
Wow, thank you.
I hope that answers your question. Yeah.
No,
yeah.
that definitely
Thanks.
did. Protect yourself and protect your family. And, you know, Roxanne, that's a perfect segue to you, because I'll admit that when I was thinking about taking the vaccine, I was not absolutely thrilled with the idea. I will be honest. I felt, though, that it's my responsibility to take the vaccine so that I'm not a potential, that I'm not going to infect one of my loved ones. God forbid my parents who are older, who are at that age of risk, my siblings who have various comorbidities, anyone. I didn't want to be the reason that somebody was sent to the hospital and or died. And I know that this is felt by a lot of people because my friends and I had this conversation. So can you kind of talk about the cognitive dissonance around knowing that we have to do what's right, knowing that this vaccine is important, but still feeling, gosh, I wish I didn't have to? Is this normal? And how do we all just kind of make peace with this duality between knowing we have to do our part and also still being afraid?
Wow. Well, Heather, you sounding just like I did. I have an 80-year-old mom who I love dearly, and sometimes she forgets that I am a nurse. In my past practice, I worked with individuals with infectious, diseases. And so I've been exposed to, all aspects of someone dealing with a serious health condition. And so for us as the caregivers, as professionals in our work, as parents or aunties, uncles, it's hard because part of you is like, okay, if I don't do this, it's like playing Russian roulette. And that's basically how I've explained it to family members and friends, even my mother. I'm like, do you want me to give you COVID? I am still working. I was considered essential during the pandemic. So I was still at my full-time work. And, working with clients, not as many, but we still had to have contact with our clients who had to come in for injections or to see a psychiatrist or an APRN. So it wasn't that luxury of being in my home and knowing that, okay, no one else is going to be here with me and sitting back. So I struggled with it. And, I did my homework, like Dr. Rhule said, researching information about it. And initially I was one of those like, oh, hell no. They came out with the the vaccine quickly. That was my first response. But after being involved in some of the discussions and looking up some information myself, I'm like, okay, SARS, COVID, similar. When they test us, even for the test, they're testing us for SARS. When we get those results, it says it on your paperwork. You're tested for SARS. That's how they know if you have COVID or not. So knowing that SARS have been around and they've been doing research, I was more comfortable. And so I did my education, with my mom. She canceled 3 times to get her vaccine. 3 times. And during that time frame, I lost a colleague / friend of mine who died of it. And I was so upset with my mom, and the daughter in me was like, I'm not talking to my mother for a few days. But I had to let her process, and I knew her fear, being a woman of the Caribbean, not really understanding, why it's important to be vaccinated. So I was able to get her to finally get her vaccines, and she did complete it, thank God. So what I do is tell people my story, my clients who may have some reservations, other friends, other family members, even my son, the conspiracy theorist, because he reads everything on the internet. And he's 19, so I can't force him. I just encourage and tell him, ask the questions that you need to ask. Talk to your doctors about it. Talk to other people who have received it, like me. I had no side effects, thank God. But just encouraging that you get the information before you just say yes or no. And the struggle for us, the human side of us, we don't want to hurt our loved ones. And that's the priority that you have to look at. Like, who will be impacted if they get COVID? And then the guilt around it as the caregiver for an 80-year-old. I would never live with myself if I knew that I caused my mom to have COVID. So whatever I can do, that's how I look at it. Priority is, what is it going to hurt to get a vaccine? I'd rather get the side effects from a vaccine than end up with symptoms and potentially die, or give it to my mother and she dies. So it is a struggle, but you have to look at the facts and get the information and talk to other people who have received it. And I think that does help with your decision making, and you'll do the right thing if need be, if it's your choice.
Great. There was a question that came in the chat. Let's see if we can get it back up on the screen for Roxanne. It asked about, generally, had you seen any common threads among your clients? Yeah, are there any common threads among clients that you're seeing in terms of things they're worried about now or struggling with during the pandemic? Is it the same or different from what you were hearing pre-pandemic?
It's about the same. And I think that the media coverage and the different sites play a big role in how people are receptive towards the pandemic efforts. We have to know that the government, and I'm talking about the public health officials and the scientists and our medical providers, they have one goal, and that's to keep us all safe and keep us alive. And so that's what I use in my sessions with my clients to reassure them. What I saw when the pandemic happened was the panic, the fear, the unknown. And then the information changed from day to day. So that also increases someone's anxiety or sadness, because it's like, are they lying to us? What's truth? What's not truth? Who's giving us the information? And then I saw, even once the vaccine came out, we in my practice, we receiving even more requests for therapy in response to what's happening now. People are tired. This COVID fatigue, what they talk about, because I know I'm feeling it. I want to be outside. I want to get back to having, the social gatherings, having the parties, etc. But to have 2 hours of fun and put my life or my family's life at risk is not. But that social isolation, it's like we need to be social or socializing like we need air to breathe. That's human nature. It's not normal to be by yourself or being in a similar to being like a hermit. So because it does affect your mental psyche, it does. No one can tell you, I love being by myself. COVID is great because I don't have to be around people. That is not true. I know about wanting to be by yourself, but when you have to be, it's a different, there's no choice. And so missing hugging my children, hugging my friends, that's huge. We starve, we're human beings. We starve for that human touch and human contact. So not having it does affect your mental psyche. You get depressed, you get irritable, you get frustrated, you feel helpless, you feel like, why am I even walking around? Like, I don't even feel like I'm alive right now. So
Right.
I'm seeing an increase in just the need for services at this point,
Mhm.
because a lot of people need somebody, an outlet to talk to. And so I encourage people to, you know, if you don't want to talk to someone that looks like me, seek out those natural supports that you have, and know that you're not alone.
Mhm.
And just remember, they're doing what they can to get us all back to some normalcy. And I'm
Right.
hoping that that will help. And if you see signs in yourself or within your family, like if you
Mhm.
notice that you're not eating, not socializing, not taking care of yourself in some way, shape, or form, and you're becoming more withdrawn from the world, then
Mhm.
maybe it's time to seek out the professionals and just get some support. It's called self-care. I don't look at mental health as not, the science part of it, yes, but it's also a self-care practice so that we can be okay, body, mind, and spirit, because that's the key. So I'm hoping
That
that I answered the question
no, you
to the
absolutely
individual.
did.
Thank you.
You absolutely did. You absolutely did. And I wanted to ask you one more question, like from our kids on the flip side of that, because you talked about all of us having to be isolated, all of us not being able to go out and live our lives like we used to. But it's interesting, our kids are saying, gosh, it looks like schools are going to be reopening in the fall. And
Mm,
after a year of being home or, wherever they reside, and taking classes online, or those kids who went from 8th grade and then spent their 9th grade at home, which we know is a really hard transition year, they got an opportunity to do that outside of the normal high school environment. Those kids are now saying they feel a little anxious about
yeah.
going back to school full time. They're
Mhm,
experiencing social anxiety, particularly when they're hearing about some of the changes that are going to be made, going from 6 feet to 3 feet in terms of
mhm,
separation, but also just being after being home for a year, going back into the school environment. Like
mhm,
what can you give us to help our kids, their families,
mhm,
sort of help them work through those feelings and deal with this sense of anxiety that some of them are
mm.
experiencing about going back into an in-school learning environment.
Okay, so as a parent, I don't have any any children in school anymore, but even dealing with my own when they had to make that transition from one grade to another or a new school. I think that as the parents, we need to just have those conversations with the kids and kind of prepare them and let
Mhm.
them know that things are going to look different. And I'm sure that the schools, even with the schools, I know that they keep the communications open with the parents, but really encouraging the teachers and the counselors and administration, the school officials, to really give the parents the tools that they need to have the conversations to kind of mentally prepare their children before they go back. Yes, going to a new school and adjusting to that is very stressful on a teenager or a middle schooler, or just changing schools and period is challenging. But now you have to think about, how do I protect or keep my child safe without putting the fear in your child that they're reluctant to want to go back. And we've seen that. I've had other discussions about that. Their children don't want to go back to school because of the fear of, you know, catching COVID, or just not fitting in, or having to be separate from their friends, and being in little um, enclosed spaces. So if you have those discussions now and kind of prepare them, like this is how it has to be, still reminding them of being mindful of the mask, the hand washing, the allowable social distancing that they're supposed to have, and reassuring them that it's just one more step for us to all become better one day. Instill that hope in them, because they still need to know that this will pass. We will survive this. We just have to take these baby steps until we can get to where things are back to normal. And I think as the parent, the more information that you have, there's plenty of resources on the CDC website as well as the Department of Public Health website about how to talk to your children, and just keeping it as normal as you can, and preparing them, doing some structured activities with them outside of the home. You know, some places are opening up. Go out to dinner, with your children. The restaurants have the guidelines. They know how to keep safe, but get them prepared. Start returning to some of those activities that you're allowed to. Church, or, if you go to a family event and it's outdoors, practicing those same parameters, the mask, we sit together, but getting them prepared mentally as well as physically so that they're not traumatized when they return to the classroom, and making sure that you keep up with they're talking to them and asking them how they're doing. How was your first day? And really hearing what they're saying and reassuring them that it will get better. We just have to be a little more patient.
Right. Gosh, Principal Richardson, you are going to get all the kids who have been prepared to come back into the classroom full time, and you're going to get the ones who haven't been prepared to come back into the classroom.
Yes, ma'am.
Yeah, you're going to get everything. And more than that, you're also going to get kids who, for the last year, have been taking classes, for a good amount of time from their homes. How are you and we are getting yourselves ready to kind of help these kids get their learning mojos back, and also prepare for them in terms of any supports for mental health and emotional well-being?
Yes, so it's important to note that our students have never been without the opportunity to come to school. And our ninth graders, because it is their first year in high school, they have pretty much always had the opportunity to be on campus multiple days per week. And so in our preparation for our students that have chosen to remain in a remote learner status, we have a number of strategies that we use. We do home visits, we do calls. Our whole learning model, which we created for this year, which is a version of the flipped classroom model, lends itself very well to being a blended environment where you are in person and where you are online. And so we put that in place to help support our students. But we have students with a myriad of barriers, from having to work, to having the COVID anxiety, to just being fearful. So there are a number of things. So pretty much we do outreach, and then from outreach, we're able to drill down to what individual students or groups of students might need to help them feel more comfortable transitioning back into school. And so we have students that come right now. We are on a 5-day schedule, Monday, Tuesday, half day on Wednesday, Thursday, and Friday. And we found that as some students were coming back into school, that the 5 days were a little bit too much for them. And so we have students that have what we call individualized transition pathways, so that we're able to, as the need arises, to make a plan that is very much individualized and specific to what that particular student and that particular family needs at this time. So that's one of the ways, and I'd said a lot, but that's a couple of the ways that we do it. Another, go ahead.
No, I was saying that's fantastic. It's good to know that you have those individualized approaches to ensuring that all the kids are getting what they need.
Yes. In addition to that, we also use Wednesdays as a connections day. It's a half a day. So on Wednesday, students participate in virtual webinars around college and career and post-secondary planning, webinars on how to cope during COVID, webinars that are related to social justice, town halls with the other administrators and myself, as well as having opportunities to be restored. So even with the individualized plans and the our learning model and all of that, we still found out that we were still losing students, which gave birth to our restoration plan. And so that is essentially a plan where students can come in and work with specific teachers on recovering learning loss, recovering credit, recovering lost time in their program of study so that they have hope with returning. So if you think about it for a moment, if I'm a student and I failed marking period 1, marking period 2, and now, we just ended marking period 3 on Friday, what hope do I have to come back to school, even if you reach me, right? And so in helping to mitigate that and restore hope, I just gave the vision to a group of teachers who took ownership of it, and the restoration plan was born. And so students can work on it on all days, but on Wednesday, we've actually carved out time for students to go in, meet with their teachers, either virtually or in person, and really focus on one particular class at a time, not doing makeup work, because that can be very overwhelming. But as opposed to that, doing some type of a project-based learning activity, like a portfolio, just something to demonstrate understanding of key concepts to help support our students. And so we do that on Wednesdays. Wednesdays also ends with a club day. That's how we get a little bit more of our social emotional learning in. Pretty much most of the adult staff have a club, not just our instructional staff, but our support staff also have clubs. And during that time, we actually have those one-on-one opportunities to build a relationship with students. We have academic clubs such as Esteemed and DECA. And then we have more social clubs, right? Such as there's a meditation club, there's a salsa club, there's a walk and talk club, there's an anime club. And then we have athletic clubs. There's a basketball club, there's a kickball club. And so essentially students and teachers select the club of interest. And that's another way that we kind of bond with students in their socialization. I have a club, administration has a club, and I have a girl power club. And all we do is just simply walk and talk about issues that come up for our students. One of the things that I have always believed, and it was really emphasized during the COVID-19 pandemic, is that trauma that is not transformed will eventually be transferred. And so when we see behaviors amongst our students, and we serve a minority population, when we see behaviors amongst our students that other people might say, oh, they're undesired, right? We're more cautious now to say, wait a minute, where is this coming from? This is just not coming today. There's something that's underlying. And how can we help address that? Let's kind of get to the root of the problem instead of trying to just, deal with the leaves, as for lack of a better example. And so that's what we have found doing all of these things, and a whole lot more, right? We do a whole lot more that we have in place for our students to help get them not just back into school, but back engaged in school in a meaningful way with a solid path forward for them to finish the school year in a way that they can feel that they have been successful. And we do that, largely with our staff. We have some great community partnerships that we work with, business organizations that we work with, and we all just pull together to make it happen for our students.
I love that, the restoration plan. I mean, That just sounds like something very special. One of the things that we were worried about when we first started this series of conversations was the education and achievement gap that our kids already experienced and where they would be at the end of this. You know, we never knew how long it would be, but now we're looking about a year and a half out from the onset of COVID-19 on our shores. What have you seen in terms of that achievement gap, that education gap? Has it widened whilst kids have been at home dealing with their families and everything that goes along with COVID-19?
Well, of course it has, right? Widened it because you have an issue of access, right? And in some cases, you have an issue of awareness, right? So if we talk about, for example, college fairs, right? Our virtual college fairs have gone on without a hitch, right? Nothing has been interrupted around that particular aspect of the work. We're currently planning an apprenticeship fair, right? Where students who perhaps do not want to go to college can also explore opportunities, being in HVAC, electricians, barbering, cosmetology, plumbing. You know, all of these are very viable careers and they're in high demand right now. And so those types of things have continued. Classes have continued. In some cases, classes have gotten better because the COVID situation has really compelled us to be more innovative in what we thought was possible. So that's the positive side of this. We also have the issue of the barrier around awareness, right? And access to these things because life is happening for our students. At the high school level, we have students that are working. We also have students that have been identified as caretakers for their younger siblings who are also online. And so we have a number of barriers that have created some really unfortunate outcomes for our students. In the case of Weaver, the interesting thing is that we have students statistically that submit more work than they actually do show up in the physical classroom. And so we don't know why, right? We're still exploring data to figure that out, but we have some thoughts. So one of the thoughts that we have is that students can be marked they can be marked present by either their physical presence or presence of work or activities. Because our instructional model has been the same all year and it's very easy to follow, students actually are able to get in, see what they've missed, because a lot of teachers record the lessons, record the sessions in Google Classroom, and students, when they get off of work or whatever happened, they can go in, do the lesson, and they can submit work. So we have a challenge with our attendance in that we have a large number of students that are chronically absent, but we don't have nearly as many students that are actually failing because they're actually submitting work. So when I look at that, right, I see some praises and I also see some polishes, right? So the praise is that at least students are somehow connected and engaged. They are somehow interpreting the content in a way that they can produce an activity. They can produce a task. The polish, though, is I wonder, because they're not engaged in the actual physical learning, how much learning do they really have? How much conceptual understanding is occurring? Because there's a difference between me being able to produce a product and me having conceptual understanding. And so the conceptual understanding piece is very, very important, especially for minority students, because it's the conceptual understanding that can be transferred to any other context or any other type of learning, and you will still have success. And so though we are really struggling with getting our students in, we are not struggling as much with getting students connected to their coursework, if that makes sense.
It does. It makes a lot of sense. And I really love how you've categorized these between, the concerns, but then also your polishes and trying to do some deeper thinking about why this might be the case. Two things that I'll add. One, it sounds like you also need an equestrian group to answer your extra.
Yes. I was thinking about that. I said, I wonder if that could be a club, right? Maybe we have some students that, want to be equestrians or they're interested in it. Like, I don't know, but I am going to ask students when we get back to school if anyone is interested in horseback riding, because that could really be a club. Who knows, right? The possibilities are endless. As long as we have the support of our partners, right, we could definitely make it happen.
Right, it absolutely can be. I can tell you, I'll let Mrs. Kelly tell us a little later on, but we also have virtual classes that meet during the week with some of our other kids, so we can absolutely make it happen. Yes. One other thing I did want to mention is it is important for us to keep really thinking deeply about what it is that's keeping our kids, from being present, even though they're getting the work done. I'll never forget when I was studying for the bar exam, someone, in a prep class, one of the instructors said, half the battle is actually having the information to be able to answer the questions to pass the exam. The other half of it is having the ability to sit still for 3 hours and focus. And that is, this sort of a gatekeeping exam that you have to take for law school, but for a lot of other professions as well, that we also do have to make sure that our kids not only have the ability to produce the work, but the ability to be focused. And I know that it's just a big challenge, and it's very complicated, but I really love what you all are doing at Weaver. It sounds like this is transformative education, as your bio represented. And I look forward to talking to you guys more as the year starts in the fall, and absolutely.
Well, you should come over. We are at a place now where we can entertain one-on-one, like visitors that come on to campus that are potential partners. And so you should definitely come on campus and see it, for yourself. At the school, I'll close with this. At the school, we have a very succinct focus, right? We're really focused on our instructional model to make sure that we have students engaged in meaningful experiences, regardless of the platform. We want our students, whether it be digital, whether it be in person, to be engaged in culturally relevant, meaningful experiences. The second focus that we do have is that we are, as a staff and a whole learning community, on a journey of becoming a culturally relevant and using culturally relevant teaching practices and approaches with the students whom we serve. And so our other focus is really to build in the necessary social-emotional learning supports for our students that we learn new things about every day as we are in the COVID context, which is not a static context, it's dynamic. So it's changing every day. So every time we pivot to a new learning mode or a new learning status, or we have a large number of students to return to school. We recently had 39 additional students to return to school at one time, and then in the subsequent 2 weeks after, about additional 10 to come back in. It is constantly like the first day of school. And so we have just been resilient about really making sure that we have the culturally relevant teaching plan in place, the flipped classroom model that works for our students, and that social emotional support, which includes the restoration plan and so many other things that we do, and just focus on those particular things very well for this particular school year, so that we can not just put things in place that work for our students, but also learn what additional supports are needed for our students and advocate to get those supports in place as well. So we're just as much learning every day, but I am so grateful and so thankful for our students, for our staff, for our families, because our students do keep us informed, but it has shifted, the way that we work. So now when students call the school and they ask to speak to myself or another administrator, those calls are no longer screened. They go directly to that person, because we're trying to get students in. So if you're calling me from your car, I've had students to call me from their car. They got me on one phone, they have the teacher on the other phone, they're on their way to work, and they're like, look, miss, I'm just trying to figure this out. Okay, let's figure it out. Because we're going to figure it out, okay? Right. We're going to make it happen. That's what we're going to do, right? And we have found that is what really restores the hope. I know there was a question around what kind of restores that hope. It's not just the restoration plan, it's the clubs. It's that custodian who's cleaning the hall, who is talking to the student about life and letting them know that they can make it. It's about that front office secretary when the student comes in, look, I don't have a uniform, I just showed up, right? And she calls the right person to come down and say, listen, we're so glad to see you. We're going to work on that uniform situation later, but right now we're just so glad to see you. It's those little pieces, right? When you sit with students and say, okay, here is the plan. This is the plan. Let's work through it together, you know, and that is what our students need. It's not one way. It is really showing up in the context that the student demands us to show up in. And that's what we are working to do every single day.
I just love that. I'm so inspired by what you guys are doing. I love this student-focused approach. It's obviously what we need, particularly in this time, but absolutely for our students of color and students who come from historically underserved communities and marginalized populations. So thank you so much for everything you do. Andre, yes, Andre, we're talking about being in high school and being properly prepared and dealing with the rigors of school, the pandemic, social isolation, the uncertainty around the coronavirus and how it's impacting all of our family members and ourselves. And you were in college during this pandemic at the University of New Haven. How did COVID affect your ability to be a successful college student and a student athlete at the same time?
Well, actually, when COVID first happened, it was, I believe, last year in March, I believe. And when it happened, it was a big email sent out to everybody, the students, staff, even to the janitors, saying like, school is closed. We're shutting down school. We're shutting down athletic programs, clubs, internships, anything on school is closed. Get all your stuff. You have to get off campus by, I think we got the email Wednesday. They said by Friday morning, everything had to be gone. So it was just a big change. We're like, wow, we're going home. Like COVID is real, this is actually happening. And then a person on our campus, so that email was sent Wednesday, Thursday, a person was positive for COVID. So that just brought the campus in shambles. So we're just like, yeah, we're gonna get off campus. We're gonna go home. And they said they're gonna change everything to remote classes. So everything's gonna be Zoom related and online to an app called Canvas where we're able to see our work. So first get home, you know, we're just home, enjoying home. We're like, nope, at least I'm not on campus, I have to go in person classes, you know. I can at least Zoom from my bed, Zoom from my living room, be around my family. But little did I know, I was gonna get tired of that. Every morning waking up to the same classes, seeing the same people on the internet, seeing the same professor. So it takes a toll on you mentally because just like you're waking up to the same things. We're in a pandemic. We can't go outside. I can't go outside my dorm to even see somebody leaving their dorm room to go to class. I can't see the same girl I'm used to seeing at 10 a.m. going up the hill to class. You know, I'm home. I'm sheltered by my parents and my siblings. So it takes a toll on you, but you know, gotta push through and just hope for the best.
Yeah. Did you have any concerns about, you know, your trajectory in college in terms of what your opportunities would be like, internships or externship programs or anything like that? Because you said everything was canceled. Everybody just had to go home and pack it up. You know, you're only in college for 4 years, right? And so those go by so fast. The point of being in college is to prepare for your future. Did you find yourself being anxious about losing that year on campus and that year of internships and opportunities?
Well, sadly to say, I actually had a paid internship that summer through Andrea Austin at a marketing firm. And then she had to sadly tell me like, hey, like I can't have anybody come in because let's say you come in with COVID, that just messes up my business. Right. So you got to sit back and understand like, wow, like this is really happening. People are affected by this. It's not just me. Mm-hmm. There are those who have to change their livelihoods, what they're accustomed to, so they can come and be successful in their life, you know?
Yeah.
So it's hard, but you have to just push, truthfully. Coming from my age, I'm telling everybody watching around my age or even younger, don't let one thing stop you from doing another million things. That makes sense. So one setback will never set back multiple setbacks, you know?
Absolutely. I love that. I love that. Don't let one thing stop you from doing a million other things, right? So how have you been able to catch up from, losing that internship in terms of preparing for your future? You're an engineering major, right?
Minor engineering, major is business operations.
Okay. So have you been able to catch up, or have you been able to catch up from losing that internship?
Well, and for my major as well, most of my classes are in person. So like I have to be hands-on to what I have to do. So it kind of gives me a challenge because now I have to stand in front of my computer and learn. And me personally, I'm more of a hands-on in-person type of learner. It's hard for me to learn just by talking and looking at you. I have to be with you, I have to interact with you. I have to like see just multiple things to be able to become successful. So truthfully to say, I'm gonna be honest, it sucks where we're at right now currently with COVID situation on my campus, but it's not a bad thing as well because let's say everybody on campus gets a vaccine, we're able to go back to doing the functional things we used to be able to do on a normal basis. So it's like more of a patience thing more than anything.
Okay. So spoken like a true athlete, right? The long game. You play the long game. No one shot determines the game. It's about playing the entire 4 quarters and making it to the end. So I love that. We mentioned during your intro that you got COVID-19. You did contract COVID-19. How are you feeling now?
Now I feel great from COVID. I'm fully recovered. I feel amazing. But when going through COVID, it's probably one of the worst things I felt in my life. And not even me catching it, my entire household catching it, from my mother, stepfather to grandfather catching it. It's just like, wow.
Yeah. I wanted you to talk a little bit about that because I mentioned that you were our Gen Z representative. A lot of kids in your age group just didn't believe that COVID existed, or they thought it was a conspiracy theory, or, they also thought, you know what, maybe it does exist. I want to hurry up and get it and just be done with it because it doesn't affect kids our age that bad. We saw last year kids out on spring break in Texas and in Florida, just as if COVID was not even happening. And I thought a lot about you and what you and your whole family went through. Can you tell us more about that? You mentioned your mother, your stepdad, your grandfather, everybody had COVID in your household. That had to be hard.
So where can I start from? Okay, so I had a friend come over during the outbreak. My mom let somebody come over. The one time she let somebody come over, the person ends up leaving, then I end up catching COVID first within my household because I was with my friend, of course, within the house. So, but I didn't tell anybody that I was going through anything because my mom, she's very sheltered mom. She's very loving. So she thinks if I tell her COVID, she may, I don't know, maybe World War III in that house. So I don't tell anybody I have COVID. I stick to myself. I stay in my room. I'm thinking it's allergies because it's around March, it's springtime. So I'm thinking it's probably just bad allergies. I'm just gonna go in my room and sleep and nap all day and I'll wake up feel better. Nighttime hits and it's as if a volcano erupted inside of me. Like I had, I think, close to 102 fever. I had chills all through my body. My bed was soaking wet in sweat. It was disgusting. And I kept waking up middle of the night having to get a wet rag put on my forehead, having to get up and get water. And mind you, I'm not telling my parents anything because I don't want them to overreact. I'm 21 at that time. So in my eyes, I'm a man. I don't need them to take care of me. So second day comes and my mom comes to the room like morning time, her mom likes to come and know his son sometimes. So she comes and kisses my hand, sits in the palm of my hand, kisses me. And then I think, I want to say hours later, she started feeling her symptoms.
Wow.
And then as soon as she started feeling hers, it hit her pretty hard. Yeah. And then I ended up telling her, I'm like, yeah, I've been feeling the same thing you're feeling, Mom. Like, I feel terrible. So now we're like, well, we probably have COVID. So we have to stay within our two. So our 2 rooms are next to each other within my mom's household. They're next to each other. So it came to a point where we can't leave our rooms. Our stepfather has to be the one to take care of us both. And then we also have our grandfather in another room down the hallway who has a lot of health issues. So we really cannot make sure he has it at all. We have to stay away from him, make sure the house is always clean. We're watching our tracks and whatnot. So just having everybody just catch COVID in that household, literally one by one, by just taking care of each other, it took a toll on us as a family throughout the pandemic.
Yeah, that sounds like something that nobody would ever want to go through. I'm so glad that nobody was actually hospitalized for a long period of time, and that it sounds like so far you guys are all recovering. What would you say to kids your age, college students who still don't truly believe that COVID is a thing? How would you tell them? How would you convince them that it is, and to get the vaccine once it's available to their age group?
Well, I'm first to say COVID is 100% real. It is affecting everybody day by day. And mostly people in our generation, we have more followers than leaders, sadly to say, as what's come to.
Yeah.
So if one person says, like, I'm not getting the vaccine, it's probably gonna be another 200 people who say they're not gonna do it either. So it's sad to say like how we're set up that way, but I encourage everybody to keep wearing your mask, social distance, 6 feet, and to get the vaccine. If, as college students, we want to be able to be on campus, be around our peers and whatnot, and we can't do that without the vaccine. If we get the vaccine, we're able to go outside, we're able to go to campus on parties, we're able to go to the bar, we're able to just do anything we want to do for fun, being on a college campus.
Thank you so much, Andre. I mean, fun fact, Andre is my baby cousin, and we're so proud of him for all that he's accomplished. And we all prayed so hard that he and his entire family, our family, recovered. And, we wish you well. Thank you for being the leader among the many followers. Thank you for speaking out to help folks in your peer group change their health behaviors and make good decisions around being safe, staying safe, continuing to practice activities that's going to keep them alive and healthy. So thank you so much, Andre. As we wrap up this session, we've been here for much longer than we expected, but the conversation was so rich and so good. We hope for all of you that it was worth it. But as we wrap up this session, we'd really like to give the last word to EHI CEO, Mrs. Kelly. Before I turn it over to her, though, I want to once again thank our panelists who were fantastic always. You all have really helped us understand a lot about the vaccines, the rollout in terms of what school is going to look and feel like, at least at one high school in Hartford, and what we need to all continue to do to stay healthy and keep our communities safe and healthy. So I just want to thank you all once again. I also need to send a super shout out to Tiffany Jones, who is our social media manager and media coordinator, and truly the epitome of Black girl magic. None of all of this could have happened without her behind the scenes, pulling the levers and getting our technology together. Tiffany, our unsung hero, thank you so much. Two other quick things that I'd like you to do. This session will be recorded. It's going to be added to our YouTube page, where a lot of our other content is, along with the other 3 episodes in this discussion series. Please, I ask that you go to our YouTube page, like that page, subscribe, take a look around on our content. There's a lot that you're going to learn about what we do at Ebony Horsewomen, our therapeutic equine assisted psychotherapy and other programs, how we support the community, and what a typical day in the life of our youth participants is. The second thing that I'd love you to do before we're done is please go into the chat where you'll find a link to a very, very short, under 2-minute survey. We'd really appreciate you taking the time to complete the survey so we can get your feedback on this session. We want to continue to have more of these conversations and include you in these dialogues. You are the reason why we do this. So your feedback is going to be instrumental in helping us in that regard. So Mrs. Kelly, thank you for your leadership in starting this series and hosting these and everything that you do. We're going to turn it over to you to talk about EHI, your programs a little bit, and to close us out for the afternoon.
There we go.
Yes.
Well, first of all, I want to thank the panelists as well. And I have a connection to each and every one of them. Principal Richardson, I am a Weaver Beaver. I graduated in 19 some years ago. And Weaver is one of the schools that is and continues to be, as we've seen in the scrolling, a touchstone in the community. So I am happy to hear that Weaver has a lot still going on. I was a member of a lot of those clubs myself when I was at Weaver. So I'm very happy to hear about that legacy. Dr. Rhule, I met, I think now 2 years ago. Dr. Rhule is an equestrian and he's ridden with us. And so we've had lots of conversations and then have some projects together as well. Roxanne is the most incredible woman that I have met in a very, very long time. She is a therapist. She is one of a few in the nation who is certified in equine assisted psychotherapy. And it's extremely important to have this type of service done culturally competent. And she had her firm, along with her partner, Angela Washington. These women, I think you saw them in a photo with horses, are phenomenal, absolutely phenomenal. And their firm is also, and we are so privileged to be in partnership with them in providing equine assisted psychotherapy to our community. André is my nephew and I love him dearly. And I'm very happy, as you've said, Heather, that he has recovered from COVID. I know that there were some scholarship interruptions that happened when he got COVID, or when COVID happened, that is, that may have gone away and hopefully will return. So I'm very happy that he's back and he's recovering in some manner and regaining some of those opportunities. This entire tragedy with COVID-19 has played a tremendous impact on our children. Tremendous. We were able to keep in touch with them on the lockdown through virtual classes, which was very important because I think if we had left them alone, they would have been in worse shape. And when we were able to open up again, the thing that they wanted to do was to get back with their horses. We also understand that this COVID is different than the flu. This is not the COVID season. COVID is going to be with us forever. And so it's very important that we stay vigilant and continue to wear the mask with vaccinations or not, and washing our hands until it is clear that we do have herd immunity if we are ever able to do that. So I thank you, Heather, and Heather's my daughter. Thank you, Heather, for moderating this last session of our conversations about COVID and at-risk youth. It's been tremendously important in our community. And I will end with that. And I just thank again all of our panelists for spending their time with us this afternoon and providing all of this valuable information. And with Run, Ron, I'm not coming to the thing that y'all do with I'm not coming to that, darling, but I'll see you in family gatherings later.
Run is the other one. This was DMC. Daryl.
Well, Daryl. Did I just tell you what generation I was from? Did I just do that? But I'll see you in family gatherings. So I'll turn it back over to you, Heather, so that you could make your final remarks.
Absolutely. Thank you all once again for spending your afternoon with us. I think this has been a really rich conversation. It was made better because of you all. Thank you. Stay safe, stay healthy, and get the vaccine. Until next time, take care.
Thank you, everyone. Bye-bye.
Thank you, everyone.